have an exciting day today because both of us have an extra lumbar vertebra. So usually in the spine, we've got the cervical spine up here, the neck, the thoracic spine, these 12 bones, and usually people only have 5 lumbar vertebrae. 1 in 5 people have some sort of, it's called congenital abnormality in the lumbosacral region. So it's just a matter of discovering what you have and then either mitigating the effects or figuring out how to best deal with it. And so both of us have a 6th lumbar vertebra, which inherently creates a longer spine and a more tendency towards instability. So something I'm passionate about is with women's health, often we're dealing more with loose ligaments and unstable joints rather than fixed joints, which chiropractic is really known for. And so I wanted to ask you how this manifested in your life, because you've had pain for a while, right?
Yeah.
When did it start?
Well, I think the pain mostly, I think it was always kind of existed, but when I was 12, my brother, who was about 100 pounds heavier than me, jumped off a teeter-totter and I landed right on my tailbone. And so the pain really started around then, so when I was quite young.
Okay.
And then when I was about 18, I completely threw my back out, and that's when your dad suggested that I have an x-ray, and he was like, oh yeah, you have this L6 here, which I think is creating the instability.
Great. And so why don't you stand faced here, and I want you to point to me where your main pain is.
Yeah, right, all throughout here.
So more on the left side?
Yeah, more on the left side.
So just so people know, sacrum is here, this is lumbar spine, right? These joints here, as we all know and love, are the sacroiliac. So would you say your main pain is more on the sacroiliac or in the lumbar spine?
More on the sacroiliac.
Okay, so that's the same as me, and I'm left-sided also.
Yay.
All right, you can sit down. So basically, I don't know exactly why the sacroiliacs take the brunt for this. Maybe because they're the main pelvic stabilizers. And after, when we used to be on all fours, they would literally just be floating up there having a jolly old time. And now that we're on 2 legs, they really have to translate the weight from the upper body, lower body, upper body. So when we have any sort of hypermobile, unstable, so hypermobile is too much motion, unstable, or a fixed segment, then these guys have to move extra. It usually happens one side or the other. I actually had a direct injury to this joint, actually by a chiropractic move when I was in chiropractic college, so that was a bad deal, and it's changed the whole way I've adjusted. I only ever do 1 adjustment on the pelvis just to make sure that never happens to anybody on my watch. But anyway, the sacroiliacs, particularly in women, tend to be what becomes the problem. Now, often when there is an instability here, it causes too much motion for these lumbar discs, and the body is really smart. So instead of having the hypermobility, which can create too much wear and tear at these joints and create a premature arthritis, the body will spasm down the segment. So it starts with this psoas muscle, which attaches all 5 low back vertebrae into the inner thigh bone. This iliacus muscle, another big one that tries to stabilize you really, really well, is your quadratus lumborum. And then the piriformis, and then the glute medius, these guys. Now, these blue things are the ligaments. Remember, ligament connects bone to bone. And so when you have an instability, these will inherently be stretched. Now, sometimes they're just stretched because a woman gets pregnant, has too much relaxin in her, has plenty of relaxin in her system. Also remember relaxin, which is the hormone of pregnancy that we think of that loosens all the ligaments and lets the baby hopefully just drop out of us, is present in our bodies our whole cycling life. And so it's particularly at higher levels the week before we get our periods, and that tends to be when women get injured if it's not like an over teeter-totter accident.
Right.
Now, what I've also found a lot, because sacroiliacs have become a bit of my specialty due to my own body and my injury, is that a fall on the tailbone really will, it's like it splays open these joints. And so you were predisposed to that anyway, just like I was predisposed in that chiropractic adjusting lab where that bad side posture move was done on me. I was predisposed because of what I was born with to that injury. But, you know, the tailbone whack, and also the other thing I see a lot of with sacroiliac instabilities is like if somebody's driving and they're rear-ended, or even a stick shift, that constant shearing. Sitting, when you're sitting like this, you can imagine those sacroiliacs are splayed open. So chronic, like a long time sitting can really aggravate it. Anything split leg, you know, because it's the shearing. So anything where you're coming down like this is all going to aggravate it. And so, do you have any questions so far?
I was just thinking about how that's like all you do in yoga.
Yes. So you are unique in that you are a yoga and Pilates instructor. So talk to me about that.
Well, for the past 2 months, it's funny, I think you have to like take your injuries as sort of a learning opportunity, right? So when I teach certain things now, I know from my own body, okay, this twist doesn't work unless you're really activating your adductors or you're really like engaging both of the legs, because any sort of that split movement could completely agitate, especially when you're adding another component like a twist to it. So what I really focused on is actively trying to not demonstrate anything in the last 2 months because I just can't. So I really had to take the time and do the work to like make sure that I'm cueing so that it makes sense in people's bodies when they're stepping forward without, because sometimes you step forward and you're not even thinking about it, right?
Yeah.
Because it comes from this repetitive motion, even from walking.
Absolutely. And
also like in yoga and sometimes in Pilates too, you need the pull. So you need the opposite. So you actually need to like do strength training and resistance training to build the muscle. Because sometimes people say, oh, my hips are really tight. But what I found is that they're just not that strong. So you have to strengthen those muscles.
Exactly. So if you think of the ligaments as being the bone to bone, being overly stretched, just like an ankle sprain. So one of the ways I explain this to people is like a sacroiliac joint sprain or strain. It can just be a strain, but if it's a full sprain, the ligaments are too stretched. And so it's like walking on, every time you step on it, it's like walking like this on a sprained ankle, right? It's really hard to stabilize. And you're right, when those ligaments are loose, the body naturally contracts, but that isn't strength.
Right.
That's just spasm. That hurts, right? And so it makes it a little hard to treat too, because people want to take muscle relaxants or they want to go get a massage. And sometimes that's actually more harm than benefit because you're undoing the body's natural protective mechanism. And sometimes you just need to stop the cycle of spasm because spasm creates spasm, inflammation can create inflammation. And so it's there's these different tools. I feel like with my sacroiliac, I've had to develop a toolkit for what I know works best. And one of the, body work for me is absolutely key. However, I'm very careful since I was injured by my, by a student who luckily dropped out of school. Second quarter, I'm very careful with who I allow to work on my body. And I've kind of picked and chosen how I do that. And then also with exercise, like you said, Pilates and yoga can be challenging because what our bodies also really need is strength, because when those muscles are strong, they can do the work of the ligaments that the ligaments aren't doing. So did you get re-injured in like your training with yoga? Like how has that been for you?
How did it manifest?
So this particular pain episode you're in right now.
This started like 2 months ago.
Okay.
And I think it was from demonstrating a split twist.
Yeah.
Yeah.
Okay.
And also doing short spine on the reformer.
What's short spine?
Don't
do it.
I'm not gonna do it. Yeah. You can't do it. So it's like when you're laying supine, and then you're trying to peel your spine up off of the mat using your hips and your core.
Oh yeah.
So the legs come up when they're in the straps.
Okay.
Yeah.
Okay.
Which is a lot of flexion. Which I have a really hard time with flexion.
So flexion is forward bending for people that don't know, and flexion of the trunk is largely the psoas muscles, as a backup. It should be all the abs too. But when the psoas are already doing their dangest to support you and
Yeah.
stabilize you when the sacroiliac or the low back is extra unstable, then they can cause more problem than good when they get overly tightened, because then they're yanking on your lumbars,
Right.
right?
That makes sense.
Yeah, and especially if one side's tighter than the other, they're going to pull those lumbars, so it effectively look like this forward, right? And so hypermobility in itself is not a bad thing necessarily, if it's a global hypermobility. So like when I work with pregnant women, I have to think of like, okay, they have relax and every single joint is hypermobile now.
Right.
Why does just one side hurt?
Yeah.
You know, that's the imbalance. So if you can fix the imbalance, stabilize, strengthen.
I'm curious about the hypermobility in just that part of my body, because I don't feel necessarily particularly flexible naturally.
Yeah, so you've had to work at it with yoga to like,
Right.
okay, so great question. Hypermobility and ligament laxity, that's even maybe a better word for it, is like looser ligaments is not flexibility. Because I'm the same way. I'm not particularly, like, I've never been able to touch my toes very well or do splits or anything like that. But I still have looser ligaments. And remember, ligaments don't have good blood supply. So when they get overly stretched just once, just like an ankle sprain, you lose a lot. You know, we know there's a proprioceptive nervous system, which is knowing where your body is in space, and that can get damaged in stretched ligaments. You can, because of the poor blood supply, they just have a harder time coming back together. And then everything we do puts strain on our backs, right? And then you and I, because we have this congenital gift,
I like that.
we're special. We are a little bit more prone to this stuff because the ligaments just stretch differently. These muscles are stretched like our quadratus lumborums, our psoases, everything is a little bit more stretched in order to accommodate the extra vertebra.
So is it important to really work on strengthening them then?
Yeah.
Because they're already loose.
Yes. Yeah. Well, they're stretched. And so this is, I want to learn more about this actually, but you know, there's because oftentimes muscles that are overly stretched lose like neurological response time. Like they turn off a little bit. And so what we need to do too is just to activate them, to turn them on and strengthen them.
Yeah.
And then there's this whole other thing of how do you strengthen without tightening everything,
Yeah.
because we're already tight in certain places.
Right.
Things I've really found, and I want to go through this with you particularly, is that there's certain exercises that really do help. And so the thing that's helped me the most recently is cycling, because it's glutes.
Yeah.
I did 2 years of Pilates personally, and that was great. And I learned a lot, but my body's felt a lot better just doing a ton of glute strength, truthfully. And quads and hamstrings, you know, because a lot of us, our quads and our psoas are dominant, and so the glutes and the hamstrings turn off. That's what I was kind of talking about, the overly stretched. And so whatever we do, even if it's just small activating motions to turn those back on and get them firing, that's really important when we're prone to this instability. Anything with bridge, right? Because this lengthens the psoas and it tightens the glutes and it works the hamstrings. So I love this kind of stuff, or when you're up doing the knees in and out. The other thing is knee to same shoulder and knee to opposite. Now the reason this works is because your pelvis is staying neutral. You're not doing a twist to the pelvis. And so remember, you have to hold it for 20 seconds to get to the ligament tissue, and then knee to opposite.
Keeping the pelvis neutral and just allowing the work to come from like more
it actually comes from the psoas.
Okay.
Like you start stretching the psoas with knee to opposite, and then you're stretching the outer glutes. And then let's talk about what to avoid, right? So things that the psoas don't like is a ton of flexion. So they don't like big forward bends. I've actually had like women in their third trimester who were like perfect and ready to give birth, had everything balanced, and then they did a deep pigeon like this, and completely strained their psoas. Yeah, so no pigeons. I think that You can do a figure 4 like this if, again, you keep your pelvis neutral, but it's all about really keeping your pelvis neutral. Now, what I typically say doesn't work is anything where your pelvis is in one position and then your upper body twists, right? So like if you're in the car and you're reaching back, like that can be hard on it, or any sort of like work where you're really, you know, twisting. However, what I've found is I can get away with some of that stuff if I'm really careful. Like one of my favorite moves right now is where you're like this and you just do the upper body twist. Now I think I can do that because I'm leaving my pelvis neutral. I think, and kind of, but I don't know, I'm experimenting, but that right now is feeling really good for me. But the things you really want to avoid is any sort of lift and twist, right? Or deep twists. And then oftentimes in exercise classes, there's things where you like grab a bar and you pull it up here, or you grab a bar up here and you're pulling it down. Like just be really careful, anything lift and twist. Because we know, and this brings us to the discussion, you're going to get an MRI? Okay, so most likely you're going to have disc bulges. So remember with the discs, because when you have severe pain like you're in right now, the most important thing is it doesn't radiate down the legs. And you don't have that right now, right? Perfect. Because when the pain radiates down the legs, you know that these discs are quite injured, right? So these little discs in between the vertebra are your intervertebral discs. And when you're hypermobile down here, like we said, it puts more strain. These discs with the hypermobility are much more likely to bulge. The first stage is a bulge. They usually bulge backwards and to the side, one side or the other. The second stage is a herniation. Now that's when the jelly comes out of the center and pops out and presses on a nerve. Now a bulge can press on a nerve or a herniation. Bulges are, once they're out, it's a little tricky. Now if it herniates, that's a really big deal, right? So let's talk about referral patterns, because you can learn a lot just by this. A disc herniation will hit the sciatic nerve and send the referral straight down the back of your leg, down to the foot sometimes. A sacroiliac has its own referral pattern, the nerves. It goes like this, okay?
Which is, I mean, it's coming down the hip into the hip flexor.
So it usually does that. So it comes from the sacroiliac down, and mine got so bad when I, in 2006, that I actually thought I had a knee problem too. And I just had one of those patients the other day. She was like, it's my back and my knee. Sometimes people feel it in the back and side of their calf as well. That happens to me once in a while. But it's all a result of this just being so unstable that it refers down. Okay. So when people come in, that's one of the first things I ask is like, do you have any radiating pain? If so, where is it? Because often in your situation, people will come in and say, I have sciatica. And I'm like, what is that? Like, okay, let's talk. Now, a sciatic, exactly. Sciatic pain also will happen here in the lumbar spine. It comes, the disc herniations, the pain is usually midline or just off midline. Now, sometimes a disc bulge or herniation will get so bad that the whole back will hurt, or one side of the back will hurt. But if I ask people to really locate it, it will be more above. So, you know, we have these great temples. They're called dimples of Venus. It's an appropriately named thing finally in the body. So the dimple of Venus is actually right over the sacroiliac. And so when somebody points to pain there, I know. And then I really ask them to differentiate, like, is it in the lumbars, which is just above, or is it in the sacroiliacs? So you're very clearly sacroiliac. However, when you get that MRI, you probably will have some disc bulges. Because the severity of the pain you're in right now, again, the body doesn't want the disc to herniate.
So it's trying to.
So it's giving you like a neck brace. Right? And so this is an appropriate time for you to wear braces because it will let your muscles relax. But in the giving you a brace, it's causing more issues as well right now. But disc health is really important. And so when you think about working with your sacroiliac, you're always thinking about your discs as well. and discs love extension.
So let's talk about extension, because not only do the discs like extension, it literally sucks them back in, just like a good chiropractic adjustment. But it sucks them back in, so anything flexion, they will bulge out more. And so I'm almost can guarantee you, do not get distressed if you have disc bulges on your MRI. Don't freak out about it, because it's just going to be what it is.
Yeah.
And so what we're going to have you do is, as much as you can, avoid flexion. And so the other thing is that sacroiliacs, hypermobile sacroiliacs, also don't like flexion, because it literally opens up the joint, opens up the ligaments, stretches the ligaments, right? And so I have all sorts of things. Luckily, I don't have a sitting job, so that's really hard with this. But I have, when I do a longer session, I use this stool, which brings me into what my dad calls duck butt pot belly in his old chiropractic career. So it drops you into, the other word is anterior pelvic tilt, right?
Yeah.
And I think this is cow, not cat. Yeah. So anything where you're in anterior pelvic tilt, you're safe.
Right.
And that's something that with Pilates is a little tricky, because they really teach you. I just had a dancer as a new patient recently, a professional dancer. She was like, wait, I have to go against everything I've been trained. It's like, tuck your tail.
Right.
No, don't tuck your tail. Now we want to hold your glutes strong,
Yeah.
but we want to try to hold your glutes strong as you're in an anterior pelvic tilt. So this is one of them. For people who don't have chairs like this, sometimes I even have them get, this is silly. You can get a pillow or something, but you can use like even a little roll of paper towels and put it under your bum, and you see how that drops you forward. Other places to really think about this are in the car. And so if you don't have, if you are sitting back against something, using a really good pillow, like this is just one that pushes you forward, or you can, buy one of those lumbar cushions. But any couch, any bed, even, you want to make sure you're not in this fetal position, basically. And so let's do a treatment for you. So you can go ahead and lay face down. And I like to just check the balance. Are you comfortable like this?
Yeah.
Okay. Check the balance and alignment. And your left sacrum is a little bit posterior, but I don't get too excited about that, because it doesn't matter, which is interesting. Your left leg maybe is a little bit longer, but again, we'd need an x-ray to confirm that. But we start down at the tailbone with what's called the sacrotuberous ligaments, which connect the tailbone to the sit bones. And we'll release there first with a upward scoopy pressure, ideally. And how does that feel?
So good.
Good. And then we come to the sacrospinous. Yeah, so tight.
Yep.
Now, a lot of times when I release this, if it's been chronic, it will feel almost like a bruise. Like it'll be pretty tender.
It does feel bruised.
Yeah. So I don't need to, more is not better. Not funny. So I'm gonna back off a little bit. And a lot of women, you'll find this in your teaching, will say, I have piriformis syndrome, when it's actually a hypermobile sacroiliac. Because why is the piriformis always tight? Duh, it's trying to protect you. It's wise. Your body is so smart. Then we come up to the glute medius, and that will probably be a little more tender for you again. Yeah, and since you've been getting treated with Dr. Annie, so your pelvis is in pretty good alignment right now, so I'm actually not going to do any adjustment in your pelvis today. And then we move up to the quadratus lumborums. And also, because of the hypermobility, you don't need to be adjusted in your pelvis and low back hardly at all. I probably get, personally, 3 to 4 adjustments a year in my low back pelvis area. Because since we're already hypermobile, you only want to do it if you're really out of balance. To do up here is that upper reach of the psoas. The psoas attaches right at the diaphragm. So we can kind of...
Oh, it's tight in there.
Yeah. So the areas you'll tighten up as well is in this diaphragm area, and it's called thoracolumbar junction, and above.
because again, this is really working hard to stabilize you as this is, you know, moving too much. My goal for you is to balance this out as best as possible, side to side, and then to then brace you, right? So we're gonna go up. And then let's have you turn on your back. Because the other thing, and I've even trained my husband how to do this for me, is psoas release is like key to this. So remember the psoas muscle is coming from all your lumbars, wait, over here, all your lumbars connecting in and then down right into the inner thigh bone. So with psoas, you want to do a broad contact, so at least 3 fingers, and you come right in. Do you mind if I lower this just a little bit?
No, not at all.
So here's the little bump there. That's called the ASIS. You want to come about 1 inch in, and then remember the fibers go like this, and you want to just do a nice drop in. Yeah. Now, if you are wondering if you're in the right place, you ask the person to push up slightly. Yeah, there you go. You feel that? You actually need to be a little bit more lateral.
Ooh.
Yeah. So now this is not a comfortable release. However, it's a game changer. And if you will probably feel bruised here in the skin tomorrow because of the work we're doing. However, if you could have somebody do this to you every day for a little bit, it would be a real game changer. This is excellent to do with pregnant moms as well. And if you want to get excited, you can actually follow the muscle up into its origin there on. Go ahead and push up again. And relax. Yeah. And you would be a good one to really go all the way up.
Oh.
Yeah, isn't that fun? Push up.
Fun.
Push up. Oh, good. Yeah. So your psoas are incredibly strong. I've been working really hard since at least you were 12 to stabilize you. And so we say, thank you. You've done such a good job. And now we're going to help you lengthen, loosen. You don't have to be overachievers quite to this extent. But I think it's really important. Sometimes when I work on people's psoas, they'll be like, oh, these are my enemies, or there's real negative self-talk. When if you really understand the body, you recognize, no, it's trying to help you. It's doing everything it possibly can to support you, right?
Oh.
And to just say thank you.
Thank you so much.
The other thing that is really helpful, and this is safe to do at home, is pulls, right? So this opens up the low back area and the sacroiliac joints without any twist. And so you can even do a little pull on its own. I don't recommend this at home, but I'm gonna do it. But just like a nice traction with a little pull. But this isn't also, you feel that open up. Yeah. And then also you can do some push out towards me, just lightly. Don't be an overachiever. And then pull in. And then to really activate the adductors, I do this too. So push in 1, 2, 3, 4, 5. Push out 1, 2, 3, 4, 5. And sometimes I'll do that on my own, especially when I was pregnant. 1, 2, 3, 4, 5. And this is just turning those muscles on like I was talking about. 1, 2, 3, 4, 5. Now a really safe adjustment for this is to target more that thoracic spine low down. So we can do that. Is that all right with you? So big breath in and all the way down. Great.
Oh,
yeah.
Yes.
So keeping that thoracic spine really open is going to just take that pressure also off the low back. So in this acute state, right, what we're going to do is we're going to brace you.
Yeah.
And let's go through that. So go ahead and sit up, come to your side, be an old lady. So no heave-ho, and sit up. My favorite thing is these Serola, S-E-R-O-L-A, sacroiliac joint belts. I have one of these in my purse. I take it everywhere because if I start getting sore, I'll just pop it on, and usually within an hour, I'm fine. Now, in the old days, when I was in your state, I worked 24 hours a day for 6 weeks. That's what I think you need to start there. Sleep in it, everything. So what we want to do is put it right over Well, first you loosen the cincher straps, and then you put it right over the dimples of Venus, tighten it down, and then we strap. Now, this is different than a lumbar belt. Sometimes my lumbars actually are hurting, and so we have these, but I want to show you the placement difference. So there's that. Now a lumbar belt is up here, right? So the Sacroiliac belt is lower, and then the lumbar belt, oh, that actually feels good for me too. Now I don't recommend this for you, but I just want to show you the difference. But if your low back really needs support, you could always use one of these. Now this belt, the lumbar belt, will take the place of the muscles and over long term can cause some muscle weakness in your low back, so it's not advised to wear that long term. This one doesn't cause any muscle weakness. You can wear it as long as you want. It's just letting the ligaments tighten back up.
Right.
And that's where you wear it 24 hours a day. Because anytime those spread again, you're gonna have a step back with your severity right now.
Yeah.
So let me put this on you so you can really see it. I actually have it. And you want it snug, but not too tight. Now, sometimes sitting in these isn't particularly comfortable, but you're not comfortable anyway right now.
Right.
If you weren't so acute, I would say take it off then.
Right.
As long as you're sitting in that anterior pelvic tilt. Now, how does that feel?
Feels good.
Good. So
Feels
what
really
it
good.
should feel like when I first put it on is like it felt like a hug.
Yeah. Or like a breath. Okay.
And then you can breathe. Yeah. So then just wear this as much as you can. Ice is great for acute, 10 minutes on, 20 minutes off. At this point, you can use heat as well, but make sure you're keeping the inflammation in check because heat does increase circulation, a little bit of inflammation. I don't feel like you're particularly inflamed.
Yeah.
And I love heat sometimes, you know, so I have a heating little infrared in my bed that I'll wear when I'm sore. And then real quick, let's talk about sleep. So when you are in bed, you want to make sure you have a pillow between your knees because even collapsing in like this will splay open that upper sacroiliac joint, right? So this obviously is, you know, a bad demonstration, but you could even get one down to your feet. So that you're like that would be ideal. And then if you're laying on your back, you need something below your knees as well. I would want it a little higher than this just to take the strain off the lumbars. But be careful about this sort of thing. That is not going to be your friend right now. So you really want to kind of keep your legs more together, hip width apart. And then tummy sleeping, I'm actually fine with. I know I'm like the odd chiropractor who says tummy sleeping's okay. How I tend to do that is because honestly, that is just so lovely. And you can see how your spine sinks into extension. I always put a leg up, which most people do. The big thing is the upper body and to make sure your neck isn't cocked. But if you kind of put something above, you know, where your whole upper, you're not like just like, you know, like this, but you kind of prop yourself up a bit. I really think that's okay. Just mind this because it will, and then make sure your body doesn't sink too much into, because sometimes too much into, this is called lordosis, will hurt it, but you'll know because you know your body well. But those are all safe ways to sleep. And then just be really careful about sitting, be really careful about the car.
Yeah.
Hold off on exercise for now,
Yeah.
unless it's walking on flat surfaces, no hills, because that activates the psoas, but walking is great.
Yeah.
Use your belt, because you want to keep mobile. And then I think cycling might be a fun thing for you to try.
Yeah.
I'm surprised that I do as well, because I thought it would be overworked for my psoas. It's not.
Yeah. Well, you're in extension a lot.
And I think that trunk stabilization, like just having to really activate all these muscles to stabilize your trunk is really helpful.
And get the glute med strong.
Yes. Yep.
Yeah.
Does that sound good?
Sounds great.
Okay, well, thanks for coming
Thank
in.
you.